Families are now dealing with COVID-19, the flu, and RSV, a common respiratory virus. So why is RSV so bad this year? Joining us live is Dr. William Horgan, Regional Medical Director of Quality and Safety at Backus Hospital, to explain what parents need to know about RSV to protect their children. Doctor, thank you for your time this morning.
Thank you for having me.
So can we just start off by talking about what is RSV and why is it so dangerous to young children and older adults?
So RSV is a really highly contagious type of respiratory virus. It's actually responsible for the majority of newborns and babies being admitted each year to children's hospitals, causing bronchiolitis. And it's one of the most common causes of the common cold, really. And typically we see it as nasal congestion, a little bit of a cough, sometimes fevers. In adults, it's the most common cause of nasal congestion for us. But what we're seeing is the spike, and that's because we've had 2 years of our immune system not really recognizing or seeing RSV because of our masking.
Yeah. I know we were talking in commercial a little bit about how you guys have been inundated with patients. We've been hearing stories like that as well from Connecticut Children's, Yale, all around the country. What are the emergency rooms looking like right now? How are you dealing with all of the patients?
Well, right now we're dealing with the trilogy. We're dealing with not only RSV, but we're still dealing with COVID and an increase in influenza. So the volumes that we're seeing of not just newborns, babies, and infants, but we're also seeing, older individuals coming in with complications due to their respiratory illnesses like RSV, COVID, or influenza.
Are there any symptoms that really can differentiate RSV from COVID-19 or the flu?
Not really. They're very similar. They're upper respiratory symptoms. So nasal congestion, sometimes fever, sometimes wheezing or coughing. So very, very similar in the nature of this illness and the symptoms.
I think a lot of parents right now who maybe have sick children at home are wondering, when should I be taking my child to the hospital? When is the right time to take him to the hospital rather than just maybe calling your primary care doctor?
So when your child starts to getting severe symptoms, and what the severe symptoms look like is, significant increased work of breathing. So their nose starts to flail, they get nasal flaring, they're grunting, they're not as active, they're not eating as well, their diapers aren't as wet as often. Those are significant signs that the RSV needs to be addressed and hospitalization may be required.
Definitely a very scary situation for parents, for anyone maybe dealing with this. What is your advice as far as treatment goes?
So with RSV, there is no specific treatment, but really what that is there's great testing for both influenza and COVID and RSV. And differentiating which virus your child has helps, because we do have therapies for COVID as well as for influenza. And so getting early testing when your child or infant is significantly ill will help us, because that helps us decide what therapies are effective and what we can use.
Wonderful. Well, we learned a lot this morning. And again, we really appreciate your time. I know that you're busy, so thanks for joining us.
No problem. It was my pleasure. You be safe.